Son, thank you.
Mark?
Here's a little blood orange.
It's not blood orange, it's orange. You see, it's like a blood orange.
Sure, doctor.
Yep. How about that?
Sure, yeah. Probably tastes the same.
There's also bubbler and.
Thank you.
I always try to stock it for the summer.
And then what do you do with winter?
I don't use it, I drink product.
It's refreshing.
Do you want one?
Oh, no, I'm good. Okay. I'm good.
Italian fruit juice.
I've been shopping at Aldi a lot, which we have them here, and they have juice, Simply Nature organic fruit juice is a thing about this big and this big. Mix that with chia seeds to make like a fruit puree. It's so yummy. It's just like stir it up. It's really good to just have it in the fridge to try to people will want to hear what's happening. Yeah, I see you. And I think all five of us will kind of. Janet.
I'm like, I need to sit.
They can sit upstairs. So, I guess. Were you on a trip?
We were up on Duluth and North Shore, my sisters and everybody. So it's good. So we just got back about 2:30. What's that? Yes, it wasn't bad. It got warmer yesterday and today, but it was otherwise like.
How are you?
And you?
For the first part of the week, and yeah, it was very nice.
Nice day.
So,
Even nicer tomorrow.
Tomorrow's supposed to be rain, isn't it?
That's what we
That's
like.
okay.
Friday.
Tomorrow's Friday.
Oh,
For the week.
thank you. Thank you.
I only know because everybody at the aqua sites today was saying, we can't come tomorrow. It's gonna rain for sure.
Oh,
I'll wait and see.
We'll wait for it.
We'll wait and see. You never know. It's like 99% chances.
just nice. This looks a lot better.
No.
How's your summer going? Fast, yeah. How was your trip? I haven't seen you since your trip. Was it good?
We had hard and like a lot of
That's
heavy tours, so and I was like,
Exhausted.
and listen to one more like Roman history.
Yeah.
I didn't feel like I was on Snoopy or I mean, they all start with 2,000 years ago. I'm like, okay, I know, it was a long time ago.
Just get to the good stuff.
Oh, yeah.
That start to cross over, right? Like, oh, that was sort of like that. Like, we saw a lot of great stuff
Oh, I get it.
and left some things on scene so we can go get it.
Go.
There you go.
Oh. Yeah, but you usually don't have to say on.
Well, theoretically, nice vacuum sanders were theoretically.
There you go. That is process.
She was on
In the problems with it. Oh, wow.
Yeah.
She was gonna join online.
This is so much
That's the assignment. It's so different. Oh, it's not.
What his name?
Oh, it's only for
The
the.
fifth day, and like I can see his face. The whole thing. Oh, yeah.
You can have this,
Thank you.
please. I mean, it's not mine to give.
Sounds good. Thank you, Sally.
You're good. You're good.
Yes,
Yes, I am for
the note taker.
I am for both. Yes.
It's coming.
I was supposed to know.
Oh, there's.
This his notifications are silent. Should I send it in? I just gave a little like. whoop.
For two.
Not to-
Oh, he's in person.
See? Perfect. Yeah. Disregard my text. Sorry. All right, so our full board is here, so I would call our group meeting to order. Second. Probably need it from my group. Yes,
Yes.
motion through. Yeah, everybody good.
Yep.
I'll let everyone read it for me.
I'll call our meeting to order, joint meeting with Board of Health. On our side. I guess. Before we get started, we can go around and do an intro, just to, I think we all kind of know each other, but that way. Okay, damn, Mike.
Shirley Vermates.
Okay.
Jan Ryan, oh, sorry, I skipped you. Agree.
But I'm Krista Vandenbrink.
Janet Ryan.
Mary Payne.
Ally Schultz.
Tim Cronin. Okay. Before we get started today, since this is an open session, we want to be careful we don't use any names. We'll refer to as staff, client, and I guess if we're going to talk about anything from a person from the state, just say state employee. I mean, that would probably be the easiest way. And I won't get in trouble. I guess quite frankly, the reason we're here, the first part is this medical procedures policy. And I think I can speak on behalf of our entire board. Maybe I'm wrong, but I know the majority of the board that we've been a little frustrated with the Board of Health. Goes back, how long? A year and a half ago since we asked you guys to be looking into possibly joining with the hospital or pricing that out or something, and we haven't got much feedback yet, or any feedback yet. So that's one of the things. With that, we'll probably go into the long-term sustainability. But this medical procedures policy kind of made our board aware of what's transpired, where the need for this medical procedures policy to come into place. And from our understanding, this hasn't been voted on at one of your board meetings.
I would disagree with that. We have it in our minutes that we voted on it. I have a policy that we, that it's, the policy was created, voted on, approved.
Do you have a date on that?
You like it was the March meeting,
But it states in the minutes. I wanted anything to go to the whole board. That states in the minutes, and there's other things states in the minutes. It does not state anything. The updates or whatever we were supposed to put in there. That's the problem I have, and all of a sudden, it took me 2 months to get a policy,
so
get a copy of it. But we talked about things. And I don't know, in the minutes, it doesn't state which, because I wanted, if there's a problem at public health, it should come to the board. The board, it's a board decision, not one person's decision if it should or shouldn't. Well, then Tim made the comment, well, it's maybe Janet can decide whether it's right or wrong, but I wanted it to come to the board. So I don't know which one we were supposed to put in there. If both of them are gonna be in there, or one, or?
The way
There's-
that the policy was written was that they would all be reviewed by the medical director. Currently, that's me, not my name, the medical director. The medical director will determine if there was risk for harm, and anything that had risk for harm gets elevated to this meeting.
But the board, you are not, the health board is the overseer of the Department of, or Public Health, not just one person. That's the thing in government, it's different government. Public, private entity, you can do that, but we are the governing board, not one person is. So it should be the board decision to look it over and decide, not one person. That's my gripe on it. This is a board decision, not a single person's
Well,
decision.
this board voted on it and it passed with a vote.
And, yeah, but I wanted the other way, and I'm just one person, so I ain't gonna change nothing anyways.
So
That's,
We'll take that under advisement and continue to review that.
your board of health did vote on the policy?
They
Yes,
were all handed out
Yes.
around this table. If you chose to read it or not, that's up to you.
I never had this. The first time I got a copy was that time.
They were all in our packet, so I don't know how to.
That's why, because I looked through all my papers and I couldn't find one. That's why I was wondering what, and yeah. And I got the
haven't-
minutes.
If anybody wants to review
I
it.
got the minutes of the March,
Policy.
but I don't know what changes were supposed to be put in there. That,
You asked us at the meeting to separate, not do approval of policies that were in front of us and MOS. You asked us to separate out anything that had to do with vaccinations as a separate vote. And so there were 3 different policies that had to do with vaccinations that we separated out and approved as a separate vote,
as a full board.
as a full board.
But,
Yeah.
but policy decisions by the state are supposed to come from the Board of Supervisors, is my understanding of state law.
not one person.
I don't know what you're asking, I guess.
Yeah.
We have a lot of policies in the department. I don't think the board of supervisors is probably interested in most of them.
So,
But if you want us to, we can bring them all to you for approval if that's what you feel needs to happen.
there's a fine line there. Between where we step in and it's your guys' deal. I mean, from me sitting here in this chair, I want to make sure the policies are put into place and are there and followed. I mean, because if someone comes back and sues the county, you guys walk out the door and it's not on you. Everyone's gonna look at the 5 of us sitting up
That's
here.
what I explained to
As
them. I said,
It's our responsibility. And technically, while we may have some responsibility, we have no control over what you guys do. So,
But this board has control over what happens, and you've appointed us to serve in that capacity.
yes. And we,
We're an extension of you by appointment.
yes, and with that, we expect you to do your job to the best ability. Sometimes it's a lot more than 1 meeting a month. I mean, in the last 2 weeks on Board of Conservation, we've been going through a hiring process, and I've got well over 20 hours in just on the interviewing process, as do the other 4 members. So we've been extremely busy. And that will probably go back in on the long-term sustainability here. So the second time a mistake was made, were the policies all in place by that time?
I'm not sure if I know what a second
I don't know the second.
mistake is, so I guess you'll have to share in private or I only know one that started this ball rolling to beef up our policies.
There was one just passed recently.
Do you know of it?
Where that? State had called, there was nothing to be concerned for.
That's what they
We
call
got notified from the state.
it.
Wait, how do we know about it?
I did get it.
What?
I'm on Board of Health.
I know, how did you get it?
I got a notification email.
But the rest of the board didn't?
I have no idea.
Do you receive that from a state employee?
I'd have to go back on my records and look.
But the rest of the Board of Health didn't get that.
I have no idea.
Yeah.
Then you don't know what we're talking
Did
about.
not.
Is that something you can find on your
Was that-
phone and say who it's from? If
Well,
it's from the
It
state?
ain't,
You're not gonna bring up any
No,
names.
no.
Names,
No.
I'm asking is it
Yeah.
from the state?
not looking up right at the moment.
Well, then it's hearsay right now.
No.
But
it's not hearsay.
Is it something you guys can look into?
If you
Maybe
can
I,
give me a name of somebody to ask a question of, yes, I'm happy to look
Okay.
into that.
Yeah.
It's hard for me to deal with errors if I don't hear about them.
I would totally agree with you.
And in general, in healthcare, the policy is like how we aligned it. You know, if it's human error, which happens, then we go to the patient and their family and then we go to the director, the supervisor, whoever. And then if it's a bigger issue where there was, you know, a harm, something done, then it goes to the nursing board or then it goes further. And so that's kind of how we set up this policy, was kind of how healthcare has been run. So that's kind of how we decided on that.
To clarify the issue that Dan brought up about lawsuits. For example, we had a situation that you would have heard of in the paper or heard of about our sheriff made a posting, and then the state decided that was offensive, and one legislator decided that that was a problem, and so the governor sued through the attorney general, and they sued not only the sheriff, but they sued all 5 of the board of directors. So there was 2 separate lawsuits that we had to take and defend and pay for, even though they were dismissed. So we're very careful, we're very cognizant of issues of lawsuits, responsibility, and costs associated with it. And so policy issues and things like that are important to us.
Completely back your thoughts.
Yeah.
It may look like we're overly concerned, but I'd
I
rather.
work in healthcare. I worry about liability every single day of my career. I don't take this lightly.
Yeah.
And that's why we're at there. I just want to make sure all the
I
policies.
feel like our policies are strong. One of our policies is that they'll be reviewed regularly, that we didn't just write them and forget about them. So I feel like we have a good plan in place. They're being looked at, they're being revised. In healthcare, in all of the places I've worked, is that there needs to be a feeling of no punitive actions taken to report. You want everything reported. You want near misses reported, because we learn
That's what we learned.
from coming close to making an error, from making an error. We want 0 punitive behaviors because we want everybody always talking about, wow, that was close. I'm glad I caught that. We learn from that. That's how we do better. It's how we're safer. And so our policies are written to be very non-punitive because that's what we do in healthcare to be safest.
Many things can go unreported if people are
Oh, for
afraid
sure.
that there's going to be some punitive action taken against them. Or what probably was a truly innocent error. So,
I would say 90%, well, 100% of the time, it's an error. It's a
Right.
mistake. We all
Right,
make mistakes. I get that.
But at the end of the day, somebody got to be held accountable once in a while, otherwise you just keep doing them. If they're never.
Well, we
reported,
watch for
never-
repetitive behavior. That's part of,
Never been.
it's part of having people review the errors.
But nothing's ever been done, which nothing ever has been done at the Board of Health. Nobody even worries about reporting anything because nobody does it.
That is one thing I know. It is not easy to do the hard thing and sometimes do more than you want to. You know, and maybe somebody you've known for a long time or something, and you have to do what you have to do. And as a volunteer board, that probably makes it even a little bit harder. That's something you gotta always remember too. Does anyone have anything else on medical policy? So the policies were in place back in April.
The policies were reviewed, some revised, some written, starting in January, completed by the end of March.
When was that first medical miscue? I thought that was in March. Was that early?
Christmas time.
It was Christmas. It was before Christmas.
that was before I started.
Right
Yeah.
before,
Yeah.
right
Yeah.
before.
I don't, I knew nothing
makes
about
sense.
any of that.
Time flies, so.
Yeah.
Space needs. Next item. What we do there?
I did talk to them. We're cutting back, well, maybe a third or approximately. a third.
Yeah, approximately a third, cutting out the south part. We would call it the gray door. That's the dividing line. So it's about a third of the space. Community Action, since they own the building, they have been up to measure the space already. Have no idea what they plan to do with it. It means that we need to do a room shuffle, right? And it's kind of a linchpin effect here, where we have to move some things in order for us to move some other things. So, there's some big pieces of equipment that we need to move. And we're not going to physically do that ourselves, I'll be honest, right? So that's what we need to figure out, who should help us do that moving. Is it, I don't know if you want, some stuff will go to recycling, so I don't know if you want them to also assist with that, or if we want to look at the Luther wrestlers or the football team to assist with that. I guess we need a little guidance on that.
So he said they'd probably don't be talking about something. Guys could help, he said.
Well, some of the stuff needs to go to our storage shed. Some of it probably should go or could go to the community services building. Into the garage area, but yeah, what does all that look like? And so that is a concern and question that we would have. Get in where to put it.
Yeah, with moving critical cooling pieces.
They're okay.
They're-
They don't have to be moved.
Thank you.
So you're reducing it. You're
Reducing our space by a
keeping
third.
2/3 of the space.
Yes.
Approximately,
Okay.
roughly, it's.
2 days, one to empty out. We're gonna put stuff and then
Not-
go through and have everything tagged where it's going in the other part.
Some of that already has to happen in order for us to move. It is a process. It's like, kind of like moving a house.
So Mark, this is new to us. We hadn't heard about this yet, because last time we talked about the
Yeah.
community building. So is there a
I
timeline?
just
on
went,
this?
I was hoping by 1st October.
Okay.
No, 1st September. Yeah, because this year was about 2 weeks, 3 weeks ago, 2 weeks ago. I was hoping maybe by the 1st September. That's what I told. As long as we do give them a 30-day notice, that which I did.
And that's what we're shooting for. We're trying to get all this
We
adjusted.
just gotta give them weight moving out, so we don't. Really have to give them notice, we're just giving up a third of the space, so that's already been taken care of. And they were happy, they said, I know, they said, we know what, everybody's in the same boat, everybody's gotta try and cut the back and cut expenses, and which that part of it, if somebody, was in a T where they don't got foot traffic coming in, if it's just workers, 3-4 workers, it'd be an easy space for.
So which part, we keep the side by the solarium or the other, the back?
The back end, we keep the north end, so the solarium is the south end, so that part goes.
Like, somewhere there's a care center, the Riverview Care, or what is that one?
Oh, Riverview.
Riverview.
Yeah.
They had called me when we first bought the Spectrum building. So I don't know if we had any space, and I stopped there one day just for the bug in their ear, but just intern, working. This would be, I don't imagine, yeah. 4 or 5. It's hard to think.
3, yeah, not many.
I mean, this here would be and I don't think they got much of foot traffic or anything. I don't think so. Most of theirs is out. And this would be a perfect area for that.
Mhm, that would be, yeah.
So the anticipation is that by the end of the month, you will have done the work this month, if everyone's clear.
Right.
And Mark, you feel like this is a reasonable final, like we can be done looking for other spaces with this,
Yeah, I
you
wouldn't,
think?
I would just stay here for, if we can cut around the third, then we're just gonna see what happens down there. We don't know what's gonna happen at the community service building in long term or nothing, so. I would say if
Because
we can get it down to close to 2,000 a month, that's,
HHS is gonna need all the space they have down there now, because they're making it mandatory that the employees come in a minimum of 3 days a week. Where for most of the time they were working from home. So
That's change.
their space would sometimes look like there was nobody there. Is gonna be well occupied. And then that central space, that's going to HHS, and then the county attorney is moving it to the. So, for the time being, we have no available space down there.
It's okay. It seems like a good compromise.
we'd have to spend a lot of money to. I don't know, it'd be, yeah. The worst bad thing about that area out there, the ceiling's so high, the sound retention is just
That
hard to handle.
is the space on the west side on the. Oh, maybe the west side, it would be the south side.
South side,
For plumbing and stuff like that, you're gonna have to cut concrete. Once that becomes pretty costly.
yeah, so if we can cut this down by a third and stay, I mean, that would be. It's a lot more tolerable, I guess, put it that way.
The sign that is used for messaging to the public is right outside the building. And I had been told by city officials that trying to move that, it maybe wouldn't fit in the
Yeah, it
city
wouldn't.
ordinance, which would be an issue. Because that's important for messaging. So,
So you need manpower to move out of that 1/3? Is that what you're asking, or
there's some big desks.
could we use high school silver cord hour?
Oh, yeah, maybe.
Possibly.
You know, getting a hold of the silver cord at the high school and they could do volunteer hours.
Who is in charge of that?
I bet you could talk to Mrs. Storhoff over at the high school. She can
Yeah.
help you out, figure out, or Mr. Troy.
Okay. Great idea.
Do we need the table? Are you gonna use that table and chairs and?
You bet.
Okay, I didn't know, because they could use one over here, not, can't you? But then you get a different table and chairs over there. I mean, if we were to use there.
If it's gonna get rid of a table and chairs, well, we may have.
If we don't, I'll look you up. But our intent is, yes, we will.
That one in there is
Well, one of because they'll.
1950.
I don't even think we have to talk
I
about
could say
that.
1940s.
Okay, does anyone have anything else on the space needs? Okay. Next one comes to long-term sustainability. I'm gonna go back on this. Yeah, probably remembers. A couple of years ago, when I came to your meeting, I said, guys, things are gonna have to change.
I feel like they have quite a bit, actually.
Yes, or you're not gonna be around very.
Mhm.
Well, if you ask me, we're barely hanging on now. I mean, where are we going forward? You guys have any plans? Like I said, we asked a year and a half ago for some possible answers. Joining forces or the hospital or somebody else, or
I have had off the record conversations with individuals at the hospital, and they feel like it will cost them more than what we're being supported currently, because their funding stream changes when they put public health under their umbrella. So didn't get a sense that they were super anxious to lose their funding streams by changing who they are to the state.
It's interesting. I had a similar conversation with Steve Schlesser at the that we met. And I heard the exact same thing about their Medicare level funding that they would be, that could impact them. But his bottom line answer to me was a very simple one. Give us a proposal. And a year and a half ago, I brought that proposal up in this meeting, expecting that the Board of Health would be able to respond back and give us an answer, of which, in my mind, a year and a half later, with no response, is not appropriate.
Take that. We have been working through an advisory committee with the changes in the state on what public health is, moving to one of population health to sort of redefine what are the minimum roles. And it turns out that's taken a lot longer than one would have anticipated, what the minimum we want for this community, fulfilling the state's requirements and what's a minimum to meet the needs of this community. And that's ongoing. They're meeting quite regularly. But I'm happy to sit in front of the hospital administrators, and it's hard to give them can you do it for this much money when we haven't defined what that looks like and how many staff does that take us? What does that, all I can say is, here's what our current ask is of the county. Can you do it for that? And I did not get a sense that they could do it for what our current county support is. Now, that's an off the record, let me bend your ear sort of conversation.
My question is, 4 counties that surround us have a relationship with their local hospital, whether it be Gunderson or whatever. And they have an existing relationship, and their budget is considerably less than, and it's been stated in our public meetings. The average spend currently, I think, is about a little over $155,000 a year, which is significantly less than our public health budget. So the taxpayers in this county, all of us in this room, I probably would assume that we're all taxpayers, are all, you know, we're pressed constantly by the state for the issue of property tax reform. And we're not getting, like Dan was suggesting, when they put a cap on us of 2%, et cetera, the pressure on that continues to grow. And the pressure out there in the public, if you're out there talking with the constituents that we deal with, they don't like what their property taxes are. They don't like what their school taxes are, including school taxes.
Yep. School taxes are not what they're dealing, what they're targeting to cut. The thing they're targeting to cut is county government property tax. That's about 30+% of the budget. And that's the biggest thing that they attack, and they leave everything else alone. They're not attacking the hospital levy, the township levies, or the school levies, but they are coming after the one thing that they can get headlines from, and that's us. And it's not, it hasn't in years looked to get any better, and we don't see it getting any better in the future. So we have to have this across the board with every department, period, in the county. Some of these services, like Mark was alluding to, over time, because of this, they're going to just go goodbye, because they will not. Roads will probably maybe be the last ones to go, and they'll be cut back to where you won't be having to drive on gravel.
If we have EMA in the Chickasaw County is wanting us to pick them up because they
Partner with us.
they cut their budget. Their budget is a quarter of what ours is. That's what they gave me. You deal with it.
I think
That's where we're heard of another one the other day.
And unfortunately, I think that's gonna be the pathway.
Yep.
It's gonna be a lot of
Counties working
consolidation.
together to try to,
Counties.
we're gonna have to.
And also, we might be better off to partner with other counties to do
Is there-
things together versus going to the hospital for everybody's benefit.
Is there talk of combining county health? Which is,
So,
you know,
Board of Health members have seen this before. But this is a one feature that IHHS has put together regarding public health alignment. And unfortunately, there's not a whole lot of answers to any of the questions that we all have burning in our minds. But ideally, what the state is going to do is move from contracting with 99 boards of health down to 7 districts. They're going to follow the behavioral health districts, and that map is on the second page. So the RFP for the district lead is supposed to drop here in August. And we'll see which counties go ahead and submit an application for that. In District 3, there's 2 potential counties who may. One for sure is, but there's a second that is a potential. So we'll see who gets chosen. Those applications are due in October with the selection process to be done right around the end of December. And so starting, as you can see on page 1 there, starting January 1st, HHS will start working with those lead entities to do planning for about a year and a half. And so there's 16 counties in District 3, of which we are. And the money that we have been told will be coming to the district is about $570,000. So I've just done the math, okay? If you were to divide that by 16 counties, you will get about $35,625 per county. The state has also said, well, there's going to be some administrative costs that lead entity is going to take off. Rightly so. And the state also wants to take a look at using a funding formula very similar to what's already in existence, which has to deal with the ages of people. So the older population that you have better off. Also, what is the population number? Okay. So I just played with a few numbers. If the one county were to take 15% administrative fee off, and if you were to divide that leftover money equally, it's about $30,000. So we don't know what this looks like, right? The state has not, and they will not tell us what that administrative limit is. We don't know exactly what this funding formula is going to look like. So they won't tell us anything until the RFP drops, as they say. And then it is up for those lead entities. And I will tell you, Saragordo County is the county that we are most believing is going to make application for it. And we support that one, right? We totally support them. We don't know what that will shake out for dollar amounts. Okay, so we do know that there are some counties in our district where there's only 2 people currently doing public health services. The problem is, one, Iowa code has to be rewritten because the services that HHS wants to be covered now under local public health funds will be the chronic disease and injury prevention, communicable infectious disease, environmental public health. That is not what Doug does. Eventually emergency preparedness and maternal child health. So those 5 areas. So my concern is that we're peeling back some dollars, not going to have as much dollars to throw at all of these concerns, right? Again, there's more questions than there are answers. We just don't know. The state is currently in their second round of town hall meetings with public health administrators. Supposedly, we're going to hear what the state's going to do for how they're going to do alignment. We're all in the dark until we know more, right? And if the state knows something, they're not telling us exactly. But our regional community health consultants, they've said they know as much as we know. So there hasn't been great communication from the state, but this is what we know at this point in time. And so what they're trying to do is to make sure that we can make a dent. We can start moving the needle on some communicable diseases, on some of those chronic diseases. Iowa's currently second in the nation for cancer. Well, that's not something that we should be proud of. We should instead be throwing some money at how we can take care of that. So they want to make some more concerted moves. And yet they still talk about how boards of health and boards of supervisors still need to be doing their job. We're still going to have staff. We're still going to be doing the collaboration that we already do with a lot of other partners. We partner with Helping Services for things. We already do a lot of work with the hospital and in the clinics. Taking a look at all of these different services that we provide, and most importantly, taking care of the community's needs. So in each community is still going to differ. So I wish I had clearer, more concise answers, but I don't. And we've got somebody who's on and she would probably say the same thing. She's just like, this is all the information I got.
So this will be about 2 years till this is fully.
Because right now,
A year at least.
we get 50-some thousand.
Correct. We get about $55,000 in local public health service dollars.
Yeah.
And so, yeah, I'm concerned about what this looks like. I think alignment it's okay until we start taking over the dollars. And I'm getting, that's the exact look that I'm getting that I'm concerned about is, well, who's supposed to make up the rest of those dollars? Right? One of the things that is going to shift is isolation and quarantine is going to shift from an Iowa HHS issue to a local issue. So if somebody has to go into isolation and quarantine, say for tuberculosis, we're on the hook for that. We're on the hook for paying their needs, their rent if they can't get out and work. So that's a concern. There are no great answers.
It sounds like they're just sticking to the line.
They're trying to shift the fiscal burden. And you guys have already been.
Property tax.
Yes.
Right. You guys have all, you've been handcuffed and shackled. I'm not going to deny that. You have been with what you are able to do with tax dollars.
I don't keep voting these people in who make these dumb choices. I'm gonna be right out in front of them.
It's an election year.
You've got to change the leadership before you're gonna see changes and crap like this.
It's not that much of a reduction, it's only 40%.
And I'm just playing with numbers, right? Just to give us some hypotheticals. So yes, as far as partnering with other counties, yeah, we already do work together. Like when we have a communicable disease that crosses county lines, when we've had protests, we've had to work with surrounding counties sometimes. Sometimes we do their investigation, sometimes they do ours. And that's where those lead entities are going to have to work very closely with the state to help identify, okay, well, Winnebago County is very strong in this, Winnebago County has this type of population. So we know that one of these counties really doesn't have a public health agency. They openly tell us that in their meetings. There's going to be several counties surrounding them that are going to have to help them out. And we don't know what that even looks like. So
Well, I'm just thinking
I don't like all the questions.
on a cost savings thing, because obviously that is good. It's probably long-term sustainability. Are there services we're providing now that we could cut back on to save costs that we do not have to apply?
I feel like some of the services we provide, we do to create a revenue stream, right? We got rid of our public health, our home health nursing program, which was a revenue stream. And so we've tried to beef up some of the other things that we actually can charge people for, to try to at least augment that we have to have a certain number of people in the building.
And I know you guys have raised costs. I'm just trying to think out
Yep.
loud here with,
We have, used to have a pretty robust sliding scale fee where people sometimes didn't pay a lot, and we've, everybody has a minimum, can pay or can't pay, can't pay, can't get service. Like, we've changed a lot of how we used to look at people in this community, that we were always the agency who could help. And so we've taken that away, from people. We've reduced our staff currently, by a couple of individuals. So I feel like we're trying to be fiscally responsible at this board as well. We haven't yet had a whole year where we've seen the impact of some hard choices.
it's been about a year since you guys have done the raises, isn't it? I remember
I mean, we lost,
one
we
of
just,
your meetings, and it seems like
Increases.
oh, the fee increases, but we just got rid of 2%.
That's only been
just recent.
That'd be great. So the ISAC property tax webinar, I don't know if any of you watched that. The very last slide was the news that we all know. So they talk about property taxes account for over half of the county revenue. The legislature has continued to reduce taxable valuations and property tax revenue growth. The cost of providing services at the local level continues to rise. And so their next steps, new streams of revenue. I'm not sure how a county is supposed to necessarily do some of that, right? And reduce the unfunded mandates. That happens at the state legislature level. Or reduce services and or personnel.
Unfunded mandates have not changed, only increased.
Yeah.
And there's no stomach at the state level to change that.
A lot of these other counties are just cutting services and cutting back on, just giving them X amount, like cheapest county in there in EMA. Here's
What
you
is
got.
EMA stand for? Sorry.
Emergency.
Emergency management.
Oh, thank you.
But Sean is our EMA, yeah, so now their
Good luck.
budget was $64,000. Total budget, somebody's.
It's possible that Howard County may exactly be in the same place and be looking for help also. Because all
We can't be the dumping grounds for everybody.
But can you
I'm just saying, I'm being
Make that work
straightforward.
for us, that we can actually absorb that, but make some money off of these counties, right? This is money we otherwise can't get. You can't just absorb it, you need to charge that. right?
Well, it'll be cheaper.
Yeah, and business alignment, those county lines are going.
Now we've created money in our budget that we didn't have before, at least.
The problem with
Whether or not,
hers,
how many more Sean's do you need to do 3 counties?
a group of like 3 counties together,
Yep.
it's a little rough for one person
Right.
to manage all that. So then
Two, you
then you're
can take
throwing
two.
in another employee, so then the cost savings.
But 2 is still better than all 3 counties having 1.
And I'm more efficient.
Yeah. Or 1.5, or right, like,
You have 2 guys to take 4
You
counties.
can share,
Yeah.
you can share
Yeah.
equipment
Two,
Yeah.
some of the.
knowledge and needs, yeah, all this stuff.
3. That way you've got somebody covering all.
well, we have to because we're 20, the 365-24.
Yeah.
We have no coverage. And we only have one EMA, emergency management employee who is, he's on call
Yep.
365-24.
Yep.
And if he gets sick or wants vacation,
Yeah,
you
it's just,
Carries his phone, that's what he does.
that's where you're better off having four counties and 2.
Right.
Not get up, so.
It's like every time we have,
And that may be something that is gonna happen, we'll have to see with this new realignment, like there may be some counties who say, that's not enough for us to keep going.
You
We're
got
gonna hire you to do our, disease, communicable disease, investigations, that then maybe there's an extra revenue stream for an agency that, I mean, we're bigger than most of the people around us, so I feel like we're the first look, right? So I'm not opposed to that, but if other counties
As we do it with HHS
Want to-
already.
want to hire out, our public health to do some of what they're required to, I feel like there's ability for that.
so we are applying for this lead entity.
We are not,
No.
That's why I'm not.
we are not. Sarah Gorder was applying,
I don't think we have the manpower to,
No.
right?
No, we're not.
There's a smaller county that was looking at it because they don't want
Just
to.
not, it's a fair question.
No.
yeah, no. Well, we'll work with them in whatever capacity that is, that we can do, but we did not decide to do a challenge.
is this parallel with the state, the bill was, didn't go through the state last year? For this current year on public health with regional,
That was actually for city boards of health. There's only one city board of health, and that's Dubuque. So, no, that,
One of the bills had, you have to employ the county hospital.
nope, it all,
And that
it was
some
all
counties, some
redone.
counties don't have a hospital.
Great.
Right, no, it was all redone, and it was really for city boards of health. And it was, yeah, and Dubuque. So there was a lot of brouhaha over nothing essentially. So, Iowa HHS has already introduced legislation for all of this to happen. So, and nobody knows what's going to happen, once we have new leadership at the State House. This is an election year, so we're going to have a new governor, we're going to have some new legislators. Again, it's more than a $64,000 question, but that is the elephant in the room.
Then it's not permanent,
Correct,
and it changes again.
right?
I think it's gonna take a long time to get things straightened out.
There's instructions
With,
on new levels.
can you define what the state requires the county to do as far as what services are required? And looking at that, and if you evaluate our current system, what of those are required, what are optional, what is a possibility of reduction, even though it may be painful.
So there's 3 cores, right, Krista? Assessment, policy development, and assurance that these things are being regulated. So promote and protect the health of residents through diagnosis, investigating health problems, evaluating effectiveness, accessibility, quality of health services, develop policies and plans, research solutions, enforce laws and regulations to protect public health, and then encourage, regulate, and provide services directly to ensure health goals are met. Some of the most costly things that we are forced to do, but don't necessarily get reimbursed any difference, is some of these disease investigations are quite costly. COVID was hard on us. 1 measles in this county will bankrupt us. It's a lot of money to investigate measles. Please get everybody vaccinated. If we had to enforce somebody being in quarantine with tuberculosis, that's not a short isolation. And we have to do, I don't know if that'll change. We've had to watch them swallow their pills. You show up on their doorstep once a day to administer their pills and make sure they swallow them. And so if that's really being shifted to the county, that we have to pay gas every day to go take pills to somebody, pay for their pills. If there's some stipulation that we have to cover their rent because they can't work for this month, like I don't really know what the state did before, but that's a huge shift if something like that happens. And we don't have a lot of tuberculosis, but in my reign here, it's not been 0.
And when I've talked with higher ups, kind of leading the charge here with the alignment, they recognize that, yes, Iowa code does need to be rewritten. They don't know what that looks like yet either. Part of it has to happen with the legislature, getting that approved, and then they can go ahead and do code. So, and what does that look like? What does this mean for the lead entities? What does this mean for the locals? And
We
there's some
have
basic
our
work.
partners where we can. We
Right.
have to worry about rabid dogs, right? Like when there's dog bites, that's our policies. We lean in on the sheriff's department. We have a program that's pretty fine tuned that they work on our behalf to isolate the dogs, give out the communication that has to happen legally for them. So just a lot of stuff that happens behind the scenes that has to happen. Does it happen all the time? No, but you have to be ready to react to a situation. God forbid there's actually an emergency that puts people's health in harm's way. Like we don't have enough people to manage an emergency. So then we'll lean hard on the clinic, the hospital, like we'll draw all of our partners in and they'll help us because that's what we do. But somebody has to lead that charge. And that is this department.
So sort of dog, you talking about dog bites. Anywhere, way associated with that episode? That we-
Yes. Yes, I was contacted. And that's a great example. So we have a good relationship with law enforcement to be able to work on the Board of Health's behalf for issuing those forms. That doesn't exist in a lot of other counties. It really doesn't. And so people in other counties are sometimes scrambling with what to do. So I'm like, phew, thank goodness we have that one under control.
I mean, we go to the jail sometimes and see people so that they don't have to pay a deputy to take them to a clinic for an appointment, right? Try to keep people in the right places for the least amount of dollars spent. You can't leave somebody from jail in the clinic, waiting room, right? Like you're there till they're done. So I feel like we lean in on our partners. We try to be conscientious. We've buckled our belts down and tried to trim the fat, and I feel like Teresa every month is looking for new ways to, here's a space, we can save a few more bucks. I feel like we're looking at our spreadsheet through a different set of eyes. We'll keep looking at it that way.
It's important to be prepared for, you don't think it's gonna happen until it does.
And it will.
AgriStar is a good,
Mhm.
and I was surprised how fast the state was able to get people there to deal with unemployment applications and already planning
Yeah.
together, but I mean, and I think Sean has that exercise in auctions coming up, which is gonna be a good for people to be ready, because if you don't have these things waiting in the wings, it's.
The problem is individuals don't want to take some responsibility and prepare themselves. They want the cavalry to come. Oh, there is no.
So,
In a few more months, the board of supervisors will be back in trying to work out the next fiscal year budget. 3 months from now, it'll start all over again, and the impact of what the state is doing all the way across the board will be felt.
Yeah, and I found some information from another county, that we work closely with. They're not around here. They're asking for $100,000 more than they've done in the past. And they hold a very large grant. So, yeah, and they have less people than we do. So they're actually asking for about the same amount of dollars as what we usually.
A flat 2% increase, or evaluation drops, anything at all. We're cutting a lot.
Yeah. Anything. That's
Yeah.
just the way it is.
Evaluation saved us last year.
That's
They're
the only
9.5%.
Evaluations.
Only thing we're waiting on at this point in time.
That's getting probably to a computer now. I think it's gonna have to law. Yeah, if we don't get an evaluation increase, a flat 2%.
So we'll continue to look at our budget. It's great.
I want to thank you all for doing as much as you do with the short staff you have. And for being on it
And for
and
the
dealing with the
volunteers.
changes coming down from the state. Thank you.
So I guess,
for the
just
support.
as a matter of clarification and meeting with the hospital with this list of what the ask would be and stuff, is that,
I guess the easiest thing to do without changing anything is that we can put our current budget in front of them and say, can you do it for this? Because that's what we know we currently need. We were trying to reduce to the bare minimum, what does this community need? But currently, this is working for us and we can put that dollar in front of them. I can do that.
Oh, we can cut that. No, that ain't a fair assumption, because we're doing foot clinic and home health care and stuff.
This is why we haven't been there, because we,
Do that, we're getting 50 back for a foot clinic. I mean, that ain't a fair assumption, you just throw that in front of them. We're doing services, they do a podiatrist or whatever at the hospital anyway.
yeah, so there's different rules to, we used to do a lot of.
Another foot clinic in town, there's all kinds of people that.
I'd like to hear from the healthcare professionals about that.
There are certain rules about how you can bill for foot care in the clinic, and it becomes hard to sustain in the clinic as well.
Yeah.
And so they move on to their
But we don't take,
services, and so the foot care would, in this community, would simply just be diminished to diabetics who can see a podiatrist for foot care. The other people would not be.
But that is a service we're not required to.
No, we're not required. We sure are not. It's taking care of the people here.
The only services we're required is something is provided by any other entity in the
To
county.
remember that every day we need a minimum number of people that work for us. And if we can add a service that gives us some money in the hours that they're working, that's better than hiring a minimum number of people that can't make any money. So I get that we pay,
Two people run public
Can
health.
you finish, please?
I get that we pay a total number of people an hourly wage to be in the building. But some of them have to be there no matter what, foot clinic or not. And wouldn't you rather make some money while you got the people in the building?
Two people to run public health is all you need.
Okay.
I mean, basically just to run what's mandated by the state.
Yep, and then we'll have no revenue stream at all. And we can put that in front of them. You absolutely can.
What it takes two people, I mean. $200,000 a year. Approximately. You wouldn't need as big a space, you need less space. You wouldn't need that billing system. You'd need none of that, yeah. Because we wouldn't have nothing to bill up because we ain't providing no services. I mean, you can't just go, you gotta take a whole look at our budget.
Well,
Set it down.
current salaries and fringe benefits are 426,694 for the last fiscal year.
And that'll be different since.
Yes.
Staff cuts, yeah.
So the scenarios running forward would be if we kept this staff, what are the fixed costs and what would the potential for revenue? We did the more draconian one. What would the savings be? What are we losing? And so there's probably like 4 different scenarios to look at. And I don't think, I sometimes say, well, if we're trying to cut money, I mean, don't say, here's what we have to spend. Because certainly they would say that's,
Yep.
will be all of that plus more.
Yep.
So I would say, here's what would it cost for this to happen, this number of, like, that would be my way of looking at it, yes, but not just one. There's gonna have to be like 3 or 4 different options.
Sure.
It would be really nice to know how our whole community we serve, both you guys and the board of supervisors. What does the community want in their services?
I feel like that's what our
That's what-
advisory committee is
Yeah,
putting together.
right,
Like,
'cause
what
we
do we
wanted-
feel meets our
Yeah.
community needs the best if we can have all the things that we feel are essential,
right.
taking care of us, if we have the money to.
Yeah, that does take time. I mean, we're just trying to update a safety manual at the county level, and it's taking us months to update a safety manual.
That's years.
Years.
Takes us
So,
20 years.
I'm trying to point out that county government does move at a snail's pace for a reason. You
We
got,
are working with good intent on
And you are
defining what the
meeting-
minimum is, yes.
And the other thing, I don't know how much, you can't just defer everything to the free clinic or the, it's, we'll see what happens in the post-bill. I mean, what's gonna happen when the systems are overwhelmed?
Right.
Right.
No, people don't have insurance.
How's the breakdown gonna be?
Yeah.
But we can't take Medicare or Medicaid patients, so we're just limited to cash customers, so that's all we're limited, so it ain't the whole county. Well, it's just it's a very small portion of people that we can serve.
It's a lot of people whose families, to keep them in their homes, ante up to keep their parents in their home.
And while asking the residents of the county what they want and providing them, be nice,
Yeah,
but with the cuts and cuts and cuts.
I mean,
There's a lot of good programs out there.
develop a endowment for this agency and ask people to donate to it. People,
I think that'd be a great idea.
Mm-hmm.
people pass away and have funding that there are a lot of people who would say, I'd love to give this to an endowment at your space, that we can have some sustainability when our current government is not willing to let us.
You know, that happens a lot.
Pay for mandates.
Hospice.
Yes.
Yep.
There's a lot of.
That's a great
I mean, and that's
possibility to speak
that's a
about.
question for our attorney. How to do that. If you can.
Seems like a good ask.
Community Action has some funding.
Yeah,
arm.
upwards to Portland,
Upwards to
somebody could
Portland.
put together.
You are a nonprofit organization, so.
So all good ideas.
We're government.
And we do want to be cognizant of how we're spending the money. However, we also want to be providing services that our community needs. Like it's balance as far as like meeting the needs. Serving.
I can tell you that with these cuts and cuts and cuts to all of these programs in the state of Iowa, it's gonna cost us all a lot more with increased emergency room visits,
Right.
increased deaths, increased, I mean, it's ridiculous. And
The
all
hospitals-
what we're saying, okay, well, I guess we'll have to make do. And instead, what we should be doing is rising up and saying, stop. Stop doing this to the people of Iowa. Nobody's asked you to do this to the people of Iowa. And that's where we're at right now.
And the majority of the people in Iowa aren't asking for it. No. For the cuts.
No,
Right, that's what I'm saying.
They would rather have the preventative.
They want the services.
Just goes to, say, roads. I have
Right.
people come up to me all the time, raise my taxes,
Right.
fix my
Okay,
road.
right.
Fix my road.
That'd be a great idea,
Yeah.
but sorry, that's way above my pay grade.
Except that we all vote. And it's for the people, by the people.
But fortunately, something will happen and then all of a sudden there will be funds that will be leveraged.
Pandemic.
Yep, it will happen.
So can I just request that on our next agenda that we have a line item for deciding who can have a meeting with the hospital and what our plan A, B, and C might look like?
Yeah, I know we'd appreciate that.
The question you gotta know what the plan is and where you put numbers to it. So that would be great. Thank you.
Is there anything else that you would like us to add to?
Hey, Steve?
So I frequently attend the hospital board of directors meeting. Not every month, usually once a quarter, so that I have a feel for what's going on there. So that's the reason that I have conversation with them.
Sure.
And they have asked me on numerous occasions because they come to us certain times a year, also once a year.
And we don't generally report to this board. Christy usually gives a summary of our space and Mark sits on the board, so we have not made it a point for this board to come and present anything at your board. Is that something that you need, or Mark is adequate as our liaison?
I think it's good to have open dialogue with everybody and come up with other ideas. Maybe three, every quarter, something like that.
Okay.
I don't know if that's too much to ask.
Well, Krista's come quite often
Yeah.
during the year, but if board members want to come with her, that's
Yeah.
always welcome. Absolutely.
More than merrier.
Sometimes their availability. Right, we run against that.
Most of them other jobs,
They did.
Yeah, this board is volunteer.
which is thank you for your service.
So we got everything?
Oh, yeah.
Motion to adjourn.
Did you have something?
Well, this isn't gonna change the outcome of the meeting, but it's probably incumbent on me if I sat through a meeting and I was alive to make sure that we understand. There were some parts of the legislative session that did restrict school funding this year. So I've been waiting 30 minutes to get that in.
Hey, I get to see your face when.
No, but, and I know that won't change anything here, what we said.
50% of our tax bill can.
And
I didn't say we took most of it on, I'm just saying, the state, reapportioning some of the save penny, which made it difficult for schools that had borrowed against that. And those districts are in trouble and in danger of defaulting on loans and we weren't in that position, but, that wasn't something we bargained for.
also,
But we all have to, it's a leaner time for all.
They could have bond issues like we have difficulty with that, like South Wind has one coming up on September 8th. You know, but that's another.
Physical.
Yeah, I could talk to you about that as well. If you want, because
Steve,
with the property valuations changing, that's gonna mess. That's not gonna get the outcome you want if you've got a debt service levy
and
from the state level. But
Steve,
that's-
Steve and Dan, who are on city councils, and cities are gonna be even more.
Oh, for sure.
Yeah, than the counties. And we were talking, all on us, no cities are under the same cuts, so it's all.
Well, thanks for putting your, all your time in today to meet with us when it worked for us. So thank you.
Yeah, thank you.
I'm glad you were
For coming today, and I do think that open dialogue is meaningful and, Yes, thanks for your support of public health in your class.
In the future, if we have to, you guys would be willing to come back and do this again?
We set something for the, 3 months from now or 2 months or. Did you where we're at with the,
See where we're at.
Let me, once we know that we have some things to share, we'll come back together.
let's do it.
Okay.
Okay, I have a motion to adjourn. Second.
I'll take a motion from my group.
I motion to adjourn.
Second. All right. Yes, Ally.
Thanks, everybody.
Still.
Okay, thanks, Steve.
Thank you.
Oh. When we switched to Verizon years ago, I was living in Wisconsin, we specifically drove out to, we got a family farm out back. It's a big deal, and specifically drove out to Verizon would work there, and it did. I was actually, I didn't love their best. We had to go sit there.
Okay, turns us off at 2, well, there's less than.
Yeah.
No, you guys can say what you want until there's less than 3 of us.
You wanted one?
Nice to meet you.
Before.
Yeah. Oh, no, I have.
Yeah, that's really good.
Interesting.
Yeah, she could have that. It's, nice to say, whether you're not, no, it's, you're not, but you're not getting.
Adjourn the meeting.
Like in the last.
She has to wait till we.
You're- so you have to wait till there's, yeah. Yeah. Rules.
I know.
I'm learning. Well, I found myself in the chair seat and I don't run a
Very
meeting.
nice to see you again.
Nice to see you.
You too, bye.
Oh, I didn't have any concerns.
You just said.
Thanks, Janet.
Yeah, thanks.
So the property tax bill, so